Assalamualaikum warahmatullah and a very good morning. On behalf of the organizers, I would like to extend a warm welcome to all participants joining us for today's webinar from Malaysia, the SEAMEO network, and affiliated countries. Ladies and gentlemen, this webinar series was initiated with the aim in mind to share the knowledge, discuss topics on biomedical research, and present research outcomes. In conjunction with World Environmental Health Day, on 26 September and in light of our continued effort to curb this pandemic, today's theme is prioritizing environmental health for healthier communities in global recovery. I am Dr. Nik Muhammad Nizam Beni Hassan from Environmental Health Research Center, Institute for Medical Research, National Institutes of Health, Ministry of Health Malaysia, and I will be the moderator for today's session. With me today are two of my outstanding colleagues, researchers in the field of environmental and occupational health, who will share their work with us related to today's theme. Before we continue further, however, allow me to announce a few housekeeping messages from the Secretariat. Firstly, we will not be taking questions during the presentation. However, a Q&A session will be conducted after all speakers have presented. Participants who wish to ask questions can do so using the question submission link provided in the email and YouTube channel. Due to limitations, we expect about maybe 1 to 3 questions per speaker for the Q&A. However, questions not answered live will be answered by email by the speakers. Participants should also be aware that an attendance link is provided in the YouTube channel for those who would like to receive an e-certificate of attendance. Please note, this link is only valid during the live webinar. And lastly, don't forget to subscribe to our YouTube channel. Ladies and gentlemen, as I have mentioned, for today's webinar, we have two speakers. Our first speaker is Dr. Zurahanim Fasha Anual, who is a senior researcher at the Health Risk Assessment Unit, Environmental Health Research Center, Institute for Medical Research. She has a degree in environmental science from University Kebangsaan Malaysia. She did her master's in public and environmental health science at the University of Birmingham, United Kingdom. And she obtained a PhD in applied science from the University of Canberra, Australia, where she focused on speciation of mercury in seafood and risk assessment. Her research interest is in water quality studies, particularly on determination of heavy metals in water. She has been involved in research assessing neurobehavioral performance among estate residents consuming privately treated water supply. She was also involved in a nationwide study determining urine mercury levels among dental health personnel. Recently, she was involved in a surveillance project determining metals in internal organs of chicken and cattle as well as canned food. For today, Dr. Zurahanim will be sharing her research experience in her presentation entitled Exposure Assessment of Urinary Metals Among Malaysian Adults. Dr. Zura, the screen is yours.
Thank you, Dr. Nick, for the kind introduction. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and a very good morning, everyone. First and foremost, I would like to thank the organizer for inviting me as a speaker for today's webinar. It is truly an honor and I thank you. Okay, this is the overview of my presentation, by which it will follow these headlines. For the introduction, Environmental contaminants can be found everywhere in the environment. They are in the air that we breathe, in the water that we drink, in the food that we eat, in the soil that we play, and plethora of other media. While some environmental contaminants or heavy metals are short-lived in the environment and may elicit no harmful effects in humans, other heavy metals tend to bioaccumulate in the environment or persist for a long time in the human body due to frequent exposure, potentially leading to adverse health effects. In this context, the heavy metals that I'm referring to are lead, cadmium, arsenic, and also nickel. As we know, lead can reduce IQ among children and cause renal impairment, while cadmium may cause bone demineralization and also kidney damage. Arsenic, on the other hand, is a carcinogen through inhalation and oral exposure, while nickel may cause chronic bronchitis and reduce lung function. Recently, as Malaysia has transformed into a heavily industrialized nation, more and more chemicals are being utilized in a variety of industries. These heavy metals can enter human body via 3 different routes of exposure, namely ingestion, inhalation, or dermal absorption. It is crucial that the development of the nation should take into account the sustainability of the environment. We are aware that we need to continue progressing, but at the same time, pollution to the environment has to be reduced in any way possible. This is where the human biomonitoring plays a major role. Human biomonitoring, or HBM, can be defined as the method for assessing human exposure to chemicals or their effects by measuring these chemicals, their metabolites or reaction products in human specimens. Human biomonitoring aims to provide information on environmental exposures, establish baseline concentrations of chemicals in population, help uncover cultural and lifestyle contributing factors, as well as track trends of chemicals over time. The internal dose which is eliminated from the body can be tracked from biomarkers of exposure, including urine, blood, hair, or even saliva. Regarded as a widely recognized tool which is used to assess and evaluate exposure of general population, population groups, as well as individuals to environmental pollutants, several countries worldwide have successfully conducted large-scale studies and established reference values for metals and metalloids in diverse population. Perhaps the largest, oldest, and long-standing surveillance program is the National Health and Nutrition Examination Survey, enhanced in US, initiated way back in 1960s, followed by the German Environmental Survey in 1985, the Czech Republic in 1994, Korea in 1998, France in 2006, Italy in 2008, Spain in 2009, and Japan in 2010. While countries from many parts of the globe have initiated human biomonitoring assessment, Malaysia falls short on this, as we are yet to establish reference levels of populations exposed to diverse types of chemicals in the environment. To the best of our knowledge, no studies have been conducted thus far assessing pollutants in biological media on a nationwide scale among general population. So the general objective of this study is to determine the geometric mean of urinary heavy metals concentrations among Malaysian adults, while the specific objectives are: 1, to establish nationally representative urinary metal concentrations, namely lead, cadmium, arsenic, and nickel for Malaysian adult populations, and 2, to map the distribution of urinary metals using ArcGIS. For the methodology, this study is a collaboration between Institute for Public Health and Environmental Health Research Center, EHRC, IMR. Urine samples were obtained from a proof project entitled Population-Based Salt Intake Survey to support the National Salt Reduction Program for Malaysia, or in short, MyCOS, which was conducted between October 2017 to March 2018. Since this study is an extension of the MyCOS study, study design, sample size, sample collection, study instrument, and other related parameters adhered to the MyCOS study. The inclusion criteria for the study were Malaysians aged more than 18 years old, residing in non-institutional living residences, and agreed to participate in the study. Exclusion criteria include pregnant mothers, patients recently began diuretic therapy less than 4 weeks, having menses during urine collection, those diagnosed to have chronic diseases such as kidney disease, heart failure or liver disease, and those having difficulty in collecting urine. To ensure national representativeness, this cross-sectional study applied a stratified cluster sampling method. Sampling was designed to cover both urban and rural areas for every state in Malaysia. Residential units were randomly selected by the Department of Statistics Malaysia, and one respondent was selected from a household. Sample size for each state was calculated proportionally to the state's population size. A total of 1,440 adults participated in the study. Of the original sample, 429 individuals were excluded due to not a Malaysian resident, locked residences during a survey, sick, and also refused to respond to questionnaire. Another 194 individuals were excluded for reasons such as insufficient urine of less than 500 milliliters, urine creatinine levels of less than 0.3 or more than 3.0 grams per liter, and cracked sample tubes, leaving 817 individuals for present analysis. Informed consent was obtained from all study participants prior to study commencement. For each subject, the information on age, gender, occupation, education background, health status, income, smoking status, marital status, and other relevant information were obtained through a questionnaire which has been pre-tested and validated beforehand. Ethical approval of this study was received from the Medical Research and Ethics Committee. 24-hour urine samples were collected from each respondent in clean, metal-free polyethylene containers without preservatives, by which these urine samples were analyzed for creatinine and urinary metals, namely lead, cadmium, arsenic, and nickel, using inductively coupled plasma mass spectrometry. We have now reached the results section. These are the demographic characteristics of the study population, by which we can see here that females outnumbered the males. I think this is the case for any institution now. Females outnumbered the males. For age group, the respondents were majority in the golden age between 55 to 64 years old. In terms of ethnicity, 64% of the respondents were Malay, followed by Bumiputra Sabah and Sarawak, Chinese, Indian, and others, while for education level, 505 respondents, or 61.8%, had secondary education compared to primary, tertiary, and no education at all. For localities, 58% of study respondents were from rural areas as opposed to urban. For occupation, 231 respondents, or 28.3%, were housewives, followed by self-employed and work in private sector. As for smoking status, more than 60% of the respondents were smokers. For BMI, or body mass index, the mean BMI was 26.7, which was slightly more than the normal BMI of 25, with 36.5%, or 298 respondents being in the overweight category. These are the results for urinary metals. Between gender, males had higher urinary metals compared to females, and this is significant for arsenic, cadmium, and also lead. For urinary metals between smokers and non-smokers, significantly elevated urine concentrations were observed for nickel, cadmium, and lead, but not arsenic. For urinary metals between localities, those who reside in rural areas exhibited significantly higher arsenic, cadmium, and lead urinary concentrations than those who reside in urban areas. This slide here shows the urinary metals between different age categories, and our findings were the urinary concentrations were significantly different among respondents from various age groups only for cadmium. And looking closely at those aged 65 and above, females had higher arsenic and nickel concentrations in comparison with males, and the trend is apparent only for these two metals. For comparison between countries, comparisons were made using 95th percentile data for each metals. As you can see here, this study showed higher urinary arsenic, lead and nickel concentrations compared to other countries, which I have highlighted in red. Urinary arsenic concentrations in this study were the highest among the countries, and this may be due to high fish consumption in Malaysia. A study by Choi et al. 2010 reported that seafood intake markedly increased urine concentrations of total arsenic as well as other arsenic species. It was reported that per capita fish consumptions by Malaysian adults was 54.77 kilogram per person per year in the year 2016, making it the second highest among Asian nations after Japan. This is a quote from a study from my colleague Nurul et al. 2016. On the other hand, urinary cadmium concentrations in this study is intermediate among other countries, which is highlighted in green. This slide here shows the partial distribution of urinary metals among adults in Malaysia, which is to answer objective number 2, to map the distribution of urinary metals using ArcGIS. As I have mentioned in previous slide, arsenic concentrations were the highest among all metals, be it between countries, gender, smokers and non-smokers, localities, as well as age group. In this particular map, similarly, urinary arsenic concentrations were the highest among the 4 metals. It was evident that high urinary arsenic concentrations were from the East Coast, namely Kelantan, Terengganu and Pahang, which can be associated with high fish consumption as opposed to those in other regions. For the discussion, males in this study had higher urinary metal levels than females, and these differences can be due to differences in diet, behavior, and metabolism. Senior citizen, 65 years old and above, showed higher urinary levels for arsenic and nickel, which is due to longer exposure duration in their life. Smokers had higher urinary metal levels versus non-smokers, and this is similar to other findings from Motada et al. And also Lopez-Herrens et al. Between countries, this study showed higher urinary concentrations for arsenic, lead and nickel, except for cadmium. And high arsenic levels in urine may be attributed by fish or seafood consumption. And however, this study only measured total arsenic and no speciation analysis was conducted. As a conclusion, this is the first study, to our knowledge, to report urinary metal levels nationwide. This study is useful in establishing reference values for population in Malaysia and evaluate contribution of different exposure sources. Future research should take into account subjects less than 18 years old, seafood consumption data, and arsenic speciation analysis. For your information, the findings from this study has been successfully published in Journal of Exposure and Health in July 2021. I've also put the link here in case anyone is interested to have a read. Should you have any further question, you can contact me at this email address. I'm open for any collaboration if anyone would like to work together. Thank you very much for your kind attention. Thank you, and back to you, Dr. Nick. Assalamualaikum.
Thank you, Dr. Zura, for the interesting and informative presentation of your research, which I think is very useful for the relevant stakeholders and should benefit the community at large. If there is any questions that you would like to ask about her presentation, kindly fill up the form using the link given in the YouTube description section. Okay, so next, I would like to introduce our second speaker for today, Dr. Muhammad Alfatih bin Pahrol. Dr. Fatih is a medical officer based at the Occupational Health Research Unit, Environmental Health Research Center, Institute of Medical Research. His main research focus is in occupational and environmental health. Apart from research, he is also involved in training in environmental analysis, including basic statistics analysis, burden of disease analysis, GIS and remote sensing, time series, and disease model analysis training. He also has experience in working with Python, ArcGIS, ArcMap, RStudio, and NV software. He has done various research in mental health, mercury exposure, air pollution and climate change, and is currently working on air pollution assessment and on built environment-related non-communicable diseases. It is our great pleasure to have Dr. Fatih with us to share his experience. His presentation is entitled Using Satellite Remote Sensing and GIS Techniques for Environmental Health Application. So without further ado, over to you, Dr. Fatih.
Bismillahirrahmanirrahim. First, I would like to thank you for the kind introduction, Dr. Nick. Assalamualaikum and a very good morning to all participants for the webinars today. My name is Muhammad Alfatih bin Pahrol. I'm from Environmental Health Research Center, IMR. Today, I will talk about using remote sensing and geographical information system, or short for GIS, for environmental health applications. So this presentation is intended to demonstrate the usage of remote sensing and GIS in various environmental health applications, such as risk mapping, surveillance, pollution in the air, water, soil, or other climatic factors. Hereby is my presentation outline. At the beginning of this presentation, I would like to explain a bit on the concept of remote sensing and GIS. And after that, I will share some example of the research that I found related to the remote sensing and GIS in environmental health applications. First, I quote some. I take a quote from Jack Dengamon, which is co-founder of Environmental System Research Institute in ESRI. When you put it on a map, people will get it. So information related to environment is often tied to locations. There is a need of applications such as GIS as the ability to integrate different types of spatial data, which is the data related to a location. It has been used by environmentalists. For example, they can make a map with epidemiological information and visualize the distribution of disease. This will help them to learn disease trends and patterns and find relationships spatially. The data that captured by remote sensing, on the other hand, enable to visualize specific location with detailed information, which can provide additional information and optimize the analysis of environmental health study. With integration of GIS and remote sensing, it will help in maximizing the value of and help to fill the gap the environmental health research. So this is the definition of remote sensing. The word remote means not exactly in contact or physical contact, or something which is situated far away or distance. Far can be far away or slight far away. So it is an art and science of obtaining information about object or an area or from a distance, typically from aircraft or maybe from drones or satellites area. So this is the image shows the process of and the component of the remote sensing. We can see the illumination source is natural, which is the sun that emit the radiation in terms of light on the Earth's surface. When the sun quantify if the emitted light is absorbed by the surface and the remaining light is reflected and sensed by the satellite. And the satellites, on the other hand, has a variety of sensors depending on their type and the classification, which will capture information and data to be sent to the ground station in terms of transmission and reception. And then the ground station will process the image data from the satellite for analysis and prepare it for various applications. The remote sensing have two types of remote sensing system, which is active and passive. The passive remote sensing collect energy on the reflected or emitted from the Earth, such as the sun, while the active remote sensing using the microwave or radar that emitted by the satellite itself. The remote sensing data is collected in the electromagnetic radiation spectrum, which is capture the visible, infrared, and radio regions only. So the visibles the visible spectrum is that consists of red, blue, and green. And most remote sensing record reflectance which we call it a spectrum bands. So this is the example of spectrum bands and its applications. So we can see here the blue, green, red. Actually, we get from if the reflectance of most of the blue colors reflected by the air surface, it just shows water body application penetration, and the green shows vegetation, and red as chlorophyll absorption. While the thermal infrared we can use for thermal mapping, so we can detect a heat spot. So like in this example, I take from the NASA world view. In the left, the pictures on the left is the example of thermal mapping in Malaysia during the extreme weather events, which is haze captured from a NASA satellite. We can see here the satellite sensors able to capture heat spot located in Sumatra Island and the Kalimantan, which is the thick smoke flows up in the north that has caused Southeast Asia haze in 2015. In the pictures of the right shows the series of image, the shrinking of RLC from September 2000 to June 2018, which is captured by using NASA satellite. This RLC is actually the source of fishing industry and also farms of cotton and other crops in the desert of Kazakhstan, Uzbekistan, and Turkmenistan in 1960s. But it becomes shallower over the next several years, and the water level fluctuated between 2009 and 2018 in alternate dry and wet years because of the seasonal snowmelt in the spring. The difference in water color are due to change in the sediments and water depth. This shrinking of RLC has effect on the regions on the climate. The growing season becomes shorter. Many farmers has to switch from cotton to rice. The main reason behind this is because of the human activities and intensive irrigation of cotton plantation in 1960s, and because the river water prevented from reaching the lake. It also become high salty waters because of the result of plant and animal killing until it become hazardous to human. So this slide shows other example of remote sensing applications. With the first one in the top left corner is with the GPS and remote sensing innovation like car navigation system and unmanned aerial vehicle were possible. The position of an object could be accurately predicted with using GPS and remote sensing. On the right, top right here is using remote sensing technology, the ocean and the weather forecast can be obtained to locate the oil spills and determine the oil direction and speed and ratio. The third picture on the bottom left corner here is the satellite capable of detecting the large lighted structures on the ground at night using highly sensitive night camera with 100-meter image resolution. This is example the image from US. More recently, remote sense night lights data has found to use in understanding the environmental impacts of light emission or light pollution, including their impacts on human health. And the last pictures here is the one major areas remote sensing technology is utilized. Remote sensing data is used by satellites in order to measure the sea levels with the accuracy of inches. So next, I will talk about GIS, or Geographical Information System. First, I will talk about what is GIS, what example data in GIS, and what is the data source, and what can we do in GIS. So GIS is an integrated collection of computer software that data used to view and manage information connected with locations, analyze spatial relationship with model spatial processes. And data GIS has two types, which is vector and raster. The vector data represent geographic features in a map, and points, which is the XY coordinates to construct spatial features. Lines, on the other hand, represent features that to narrow areas like rivers and roads, while the areas represent homogeneous geographic features like a building, forest, and water bodies. But the raster data made up of matrix of grids occupied by pixels and cells. It organized into rows and columns, and each cell contains values that represent information such as temperature, air pollution from the air. So GIS can do a lot of things. For example, mapping where things are, show quantities, show densities on a map, and show what inside and nearby. It can show changes on map over the time. So mostly GIS can provide additional information from analysis process, mapping, showing relationship of the data in locations. And with this information, we can have a clearer picture and understand the better situation. Like example of the density map lets you measure the number of features so you can clearly see the distribution. The change on the map over time we can anticipate the future conditions and decide on the course of action and to evaluate the results of actions or policy. So I will show the example of study done by Marzouk et al. In assessment the coastal vulnerability to climate change impact. They use the GIS data model, which is the climate coastal model for evaluating the long-term impacts of climate change in delineating the most vulnerable areas of climate change to coastal zones. They found that the result of a developed model in 30 years study period revealed that the affected areas from the climate change are those located along the shorelines. This, the table one shows the climate variables that have been used in the study to estimate the modeling of the coastal models for this study. The proposed model is considered as a decision support tool, which has helped to decision makers to detect the vulnerability degree of any areas exposed to climate change impact based on the multi-criteria and parameter which has been used in this table. It gives a priority for such areas. And this one, I will show some example of a malaria mapping. This is research conducted in India, which produced a malaria susceptibility mapping in Varanasi district in India. The climatic factors, particularly rainfall, temperature, relative humidity, are known to have strong influence in the biology of the mosquitoes. So using these climatic variables with other variables like land use, population density, distance from major roads, river, ponds, and includes from distance from healthcare facilities, they produce this map, these two maps, using multilinear regression model. See, GIS can be used to investigate the association between these such variables to distribution different species responsible to the malaria's transmission. So this percentage of malaria areas is much related to distance to health facility. They have found that the 4.77% of malaria areas is belonging to 0 to 1 kilometer buffer distance of health facilities, and 24% of malaria areas comes in 6 to 10 kilometers buffer distance. As distance to the health care facilities increase, and the malaria area is also increasing. And this example of heat wave hazard modeling. This study addressed the complexity by using the remotely sensed thermal data from the land surface temperature image, along with meteorological data to model heat waves in Kota. It combined many complexity parameters that influence or determine the heat wave in the region. The model and its results are based on daily records from meteorological data for 12 years from 2000 to 2011. And then they found that the model showed the high proportion of the population vulnerable age groups are likely severely affected by future heat wave events in Qatar based on a 5 years return period. The study proves that thermal satellite image improves heat wave hazard modeling as it addressed the complex spatial variability of land surface, and the developed model is applicable at local as well as regional scale, making an original contribution to heat wave modeling. See, this is a research done by BBC, Shared Data Unit, found levels of nitrogen dioxide for COVID-19 in terms of air pollution monitoring. They found that the average Edinburgh-Nicholson Street Station average 28.3 micrograms per cubic meter has been dropped from 2019 to 2020. And then this nitrogen oxide is primarily gets in the air for the fuel burning that emitted from the cars, trucks, and buses. This can cause a health effects when we're breathing air with high concentrations of nitrogen oxide and irritate airways in the human respiratory system. People with asthma, children, and elderly are greater risk in health effect of the nitrogen dioxide. So from this map, we can see the drop in the nitrogen dioxide in 10 stations for the air pollutant as people stay at home to beat the coronavirus. So I want to show some example what have been done by my department using GIS and remote sensing so far. For your information, currently we're still exploring the GIS and remote sensing abilities and trainings and collaborating with other government ministries and universities related to NGOs and develop in our knowledge and expertise in this field. For in this first picture, we make estimated PM10 concentration in Malaysia 2013 using NASA open source data satellite from the NASA website. The AOD reading from the Terra satellite captured and calculate with other variables using a model that have been developed by the UTM universities and using GIS software to produce the estimated PM10 over 2013. The PM10 is a particulate matter in the air less than 10 micrometer in diameter, which has proven hazardous for respiratory and cardiovascular system. The second pictures on the right side here is a GIS, one of the tool of GIS interpolation method to see the pattern distribution and map for sampling point of heavy metal concentration in Malaysia. Then use the spatial autocorrelation to determine this dispersed or the cluster pattern. And the down on the left side here is a projection riverine flooding and the government healthcare facilities in Peninsular Malaysia due to climate change. This is also using GIS in this research. So our current project is the assessment of human exposure. We want to we want to assess the PM2.5 exposure in the Klang Valley using the mobile application. This is the collaboration studies that we make from we planning to do with other universities in UiTM and MMU. We want to use remote sensing and GIS to estimate the level of PM2.5 that covers all areas of population to fill the gap, the ground monitoring station. This project just started and estimate to finish in 2023. So to put in simple words, the remote sensing helped us to capture the image by using sensors, while GIS helped us to analyze and produce a result in a way that even a common man can understand with the help of map produced from the satellite data. The GIS is integrated with database operations such as queries, satellite analysis, statistical analysis, and so on. It also provides location-based information and also tools to analyze and display the extracted information in form and image captured by satellite sensors. The large quantities of the spatial and attributable data from the remote sensors can help integrate into GIS can provide powerful information at a time. We as researchers can use these tools to study environmental factors that contribute to disease, such as vector-borne disease. Remotely sensed data and GIS techniques can also be useful in filling the temporal and spatial gaps found in the ground monitoring data. So public health sectors and other environmental agencies can identify the environmental health factors at local and national levels and explore new opportunities, existing countermeasures, and create more targeted approach at lower cost and higher efficiency. So this is for now for me, and I hope you get something from my presentation. Thank you for listening. Back to you, Dr. Nick.
Okay, thank you, Dr. Fatih, for the insightful presentation. Remote sensing and GIS can be very useful tool, not only just for environmental health research, but even other areas of health-related research. So with that presentation, we will now be moving on to our question and answer session. Please keep sending us keep sending us your questions. Those that we cannot answer today will be answered by email. It seems that we have received a few questions from our audience. So for the first question, I would like to start with Dr. Zura, also to give Dr. Fatih some breathing time. And for Dr. Zura, the first question is from Mr. Rahil from Malaysia. And the question is that what are the main challenges that you face in conducting your study? Dr. Zura?
Thank you, Dr. Nick, for the question. Okay, for us, the main challenge of this study is we had urine samples which were kept at -80 degrees and they were cracked when we were about to do the analysis. And it is a challenge that we need to procure new tubes which can adhere extreme temperature in this particular case to salvage all the precious samples. And the analysis was done when I was on maternity leave, and that makes it more difficult, by which my team has to solve the problem. So I think we are not actually involved directly in the field sample collection since it was taken by the Institute of Public Health. So yeah, I think that's it.
Okay, thank you, Dr. Zura, for sharing the information. Okay, next, there's a question for Dr. Fatih. This question is from Dr. Rohaida from Climate Change Unit. Her question is, how can we get remote sensing data? Is it available open source? Do we have to purchase it? So, Dr. Fatih, would you like to respond?
Thank you for the question, Dr. Rohaida from NIH. First of all, the data that remote sensing captures from the satellites and also maybe from airplanes, we as an NIH, we use the remote sensing data from the open source unit and other government agencies such as Malaysia and also from the Malaysia and Plan Malaysia, which can another. It depends on the type of the data that you want. Maybe if such as air pollution, you might want to get the data from the Department of Environment. We are from the, if you want to put a modeling for air pollution or other heat or maybe forestation, you can use open source in NASA website. So this NASA website is actually available, and we can get the data by dates and also download it, and but we must have the capability software that can read the files, such as we use the MV software to read the HDF format because JS cannot read in the HDF format. So it depends on the needs of your research actually. So from that the objective or you which data you have you want. So you can search the data from many source from the government or open source.
Okay, thank you, Dr. Fatih. So, if there's anyone who would be interested to get the links for this data access that you have mentioned, perhaps they can email you to ask for those links. Is that possible?
Yes, you can email me to if you have queries which data that I get or what data I have experienced before. I would like to grateful to show it to you and guide you. Thank you.
Okay, thank you, Dr. Fatih. All right. So now the next question is back to Dr. Zurahanim. There's a link of a question from, if I'm not mistaken, Engineer Reynaldo Ramos from Romblon State University, Philippines. And his question is, Dr. Zura, why there is a need to determine the urinary heavy metals? What are significant effects of these heavy metals to the health condition of people? And also, he said, you mentioned that the main source of the heavy metals are contributed by seafood and fish intake. Does it mean that people will not eat this food to eliminate heavy metals to enter into the body, especially those people living in coastal rural areas? Dr. Zura?
Thank you, Dr. Nick. That's a heaps of questions. Okay, the first things first, why is there a need to determine the urinary heavy metals? Okay, basically, this is actually a collaboration research between IMR and also Institute for Public Health. So basically, when they do the MyCOS study, they have the urine samples, and we took the opportunity to actually analyze these urine samples for heavy metals. And it's not necessary that we can only do for urine, but we can do for other biomarkers as well. Okay, so the next question is, what are the significant effects of the heavy metals to the health condition of people? As I've mentioned in my slides earlier, I gave you examples like lead, which can cause renal impairment and also reduce IQ in children. Cadmium can cause bone demineralization, and also arsenic is a carcinogen which can cause cancer. And the last question was, does it mean that people will not eat food to eliminate heavy metals to enter the bodies? Okay, there is a guideline from US FDA stating that those who eat big fish, they can actually absorb more metals. So it is a guideline to eat smaller fish, since smaller fish, they do not contain as much as the big fish. So it's not that the heavy metals will not eliminate in the body. It has the, as we know, heavy metals have half time. So it means it will eliminate in the body via urine, via feces. So when you eat big fish, especially like tuna, they will have actually more metals like arsenic and also mercury. But for in this case, other metals like cadmium, it can cause the source of cadmium is from like battery, and also like lead, it can be from unleaded, from fuel. So it's not necessarily only from seafood. It's just that for this particular study, we mentioned that arsenic, the concentration of arsenic is greatly affected by intake of seafood. So yeah, that's it, Dr. Nick.
All right, thank you, Dr. Zura. So what you're saying here is that there are guidelines available for those who are living in coastal areas or those communities which are dependent on fish as their food supply. Okay, so for the next question, I would like to go back to Dr. Muhammad Alfatih. And this question from the participant is on how is the use of GIS and remote sensing can help the Malaysian community receive the best health services. For example, in the determining the vaccination centers using perhaps detection of the individual address in the MySejahtera apps. Dr. Fatih?
Okay, thank you for the good question, Dr. Ning. First of all, how the GIS remote sensing can help Malaysian people to get the best healthcare services. So from GIS, actually, we can integrate the data of populations and also the location of the healthcare facilities. So with this GIS, we can analyze the patterns of the population, which the population most dense. Maybe the populations, the healthcare facility locations is not very suitable in the terms of the populations. So with GIS, it can use to by not only on the healthcare system, but also a business system where they can to decide where the shops they want to build, and based on this population areas and also which socio-economic factors of these populations, they can help plan and also see the which areas that are most suitable to build healthcare facilities and also the shops of the business or other things. And to put PVV centers by the address by the individuals and the populations, maybe from the MySejahtera apps. This from the MySejahtera apps is that has been initiated by the government is also very helpful, and the data is in the apps also can be very useful in the GIS system. With GIS, with only of the location of the population individuals or by the XY coordinates, we can put in the maps and also see the patterns like I said just now. So the PPV and that has been served in the currently in the Malaysia is based on the locations that the most of the population will come. So the individuals from many areas have has the availability, or maybe the we call the kemudahan, maybe service that can they get easily from their place. So so from that GIS can very useful lah. But they must have the data from the MySejahtera app. If the MySejahtera app's data is available, we can use that in GIS. Yeah, it's a very it's a very useful lah. Right. Thank you.
Dr. Fatih. As a follow-up to that question and the previous question, there's a question being raised in terms of when we want to use GIS or remote sensing in research. Does it involve a lot of money? Is it expensive? What are the costs when a person or a researcher wants to conduct GIS or use GIS in their research? Dr. Fatih, can you respond to that?
Okay, thank you for the questions. For the next question is the GIS is available or free, or maybe is it a paid service? So today currently in the what we have has to offer have been offered in this particular field. Actually, there has many various software that available. So from my experience, I have experience in using ArcGIS, which is the product by the S3. It's actually a paid service. So in our research, we have some of peruntukan to use that money to subscribe the GIS yearly. So what is the difference between the paid service and the free service is actually the free service is such as a quantum GIS that available to download in the internet. The paid service and the free service is really different in terms of the tools that have that available at the software. So maybe the paid service also more user friendly, and also is much more friendly approach lah. So the data that we use in QGIS, the QGIS is also is a free service that not very many tools that have been available, and also the QGIS is developed by the volunteers or some other NGOs company, so we can it's freely for everyone. So between the paid service and the QGIS, the free service, I would say that the paid service is more suitable because it's more user friendly. Even me as a background, as a beginner, can use. So the QGIS also I have not explored much in the QGIS. So and the so I need to get back to you for the question.
Okay, thank you, Dr. Fatih. So in actuality, there are free options available compared to paid options, but of course there are certain advantages to the paid options. Okay, next I would like to go back to Dr. Zurahanim Fasha Anual. That's another question for you, Dr. Zura. And thank you so much for your excellent presentation. What are the limitations of using urine samples for biomonitoring of heavy metals? What are the advantages and disadvantages of using other biomarkers for this purpose? Zura?
Thank you, Dr. Nick, for the question. Okay, so for the limitation of using urine samples for biomonitoring of heavy metals, I think in our case, we actually collected 24-hour urine samples. That makes it difficult because all the respondents, they do not really like when we have to actually collect 24-hour urine samples. Rather than giving spot samples is a one-time through. this is 24-hour urine samples, so it has to be, you have to collect the samples and they have to bring the container everywhere. So that's actually a challenge. And also we have a lot of respondents who do not respond to this 24-hour urine collection. So some of our sample size, we cannot get the samples since due to the urine sample collection of 24 hours urine. So for the next question, the advantages and disadvantages of using other biomarkers for this purpose. So basically we can also not only we can use urine to detect biomarkers of exposure, we can also use hair and nail, by which these samples, they actually measure long-term exposure. This is invasive, it's not as blood and urine, by which this blood and urine, it shows short-term exposure. For hair and nails, on the other hand, it shows long-term exposure. And hair, for hair, 1 cm of hair length can actually show 1 month of exposure to metals. For nails, it can show longer, so it can be more than 1 month. So if you have 3 cm of hair, so it means it can show 3 cm of exposure to metals. So you can choose actually on the biomarkers of exposure, depends on which metal, because different metals show different exposure pathway. Thank you.
Thank you, Dr. Zura. Okay, next, another question for Dr. Muhammad Alfatih. A question from Engineer Reynaldo Ramos from Ramblin State University, Philippines. Dr. Fatih, can we use drone technology and integrate it with GIS or remote sensing applications in determining land use modeling and other health-related planning and analysis such as air quality monitoring? On the other hand, acquisition of data for GIS or remote sensing is a challenge in terms of free accessibility to the data needed. How we could overcome or address this data access? I think maybe the second part has been addressed somewhat by Dr. Fatih. So, Dr. Fatih, can you please respond?
Okay, thank you for the question, Dr. Nick. Drones also is a part of the remote sensing systems, which have the ability to capture remotely from using cameras, maybe other sensors. So drone technology can use to use in such an air quality monitoring. So from air quality, usually we use the sensor by the ground stations to detect maybe the particulate matter, ozones, or other health air pollutions. But drones maybe drones with from my experience of as far as I know, the drones only has a camera on it. So the camera also can capture the image from above. Maybe it's useful for land use. Maybe it's useful for detect the forestation or vegetation and such as that. So for air pollution, I didn't exactly sure if a drone has the sensors to detect the air pollutions. So maybe I need to explore further for that kind of informations. And then for the acquisition of data, the accessibility of the data we need. The government has the data of the air quality, such as the Department of Environment. They provide the air quality monitoring from the ground stations. This can be you need to request from the department to get the data that you need for the research. As far from the remote sensings, such as from the satellites, the aerosol at optical depth that are captured by the sensors of the satellite also is capable to detect the air pollutions from the above. So, but it's not a direct air pollution readings from the satellites. We need to use model and also to estimate the concentration from the aerosol optical depth of the satellites readings. So from that, we can give the estimation on the ground. because the air pollution monitoring on the ground is not exactly the same as the from the space, captured from the space. So for air pollution monitoring, I more frequently use the ground monitoring station from the satellite sensors. So if to fill in the gaps for the ground data, maybe we can use the modeling from the remote sensing. So the integration from the ground monitoring data and also the satellite data will help you to get the best model. So this is my my suggestion. Thank you.
Thank you, Dr. Fatih. And unfortunately, due to time, we only have time for just one more question. So the lucky person is Muhammad Farizal Abbas. His question to Dr. Alfatih is, are there any recommended reading to know further about the technology of remote sensing and its integration with environmental health surveillance you have mentioned regarding GIS, such as published studies or case studies? Mr. Farizal would also like to know the name of the software application which we have mentioned earlier. Fatih?
All right. Thank you for the question, Dr. Farizal Abbas. Okay, for the good questions. Actually, the remote sensing, the best to get information is from the satellite resource itself, from the web that the body that has produced the satellite. So I would prefer the NASA website and also other ESRI website, ESRI, ESRI, Environmental Research System Institute, that has been used this GIS and remote sensing widely in their company. And then I personally have been used NASA from the NASA website to get more information about these sensors, because they provide many data and that has been available open source. And then from the published case studies, you can look, you can get from the published and case studies. Actually I use in my presentation just now is what I found that are related to the remote sensing and GIS. Actually I just go through all the found articles, and then I try to see the methods if they use the remote sensing and GIS and their methods. That's methods that I use to search the published studies and the case studies. Thank you.
Fatih. I'm afraid that is all time we have for questions from participants. Don't worry, your questions that were not answered today will be replied by email. So we hope that this webinar has shed light on some research work that we are conducting at our institute, and especially at our center, Environmental Health Research Center, and would spark interest and could initiate research collaboration with others. Ladies and gentlemen, now we have come to the end of our webinar session. I would like to thank all participants for your support to make this session a great success. And of course, you may also subscribe to our National Institute of Health Malaysia YouTube channel and click for notification whenever there is a new post. Before I conclude, however, I would like to announce that we will have the next session of IMR-SEAMEO webinar series on the 26th of November 2021. So do mark your calendars. And the theme for the next webinar will be modeling infectious disease using mathematical models. All right. We hope you can join us for the next session. And until then, many thanks from all of us at IMR and at SEAMEO. Take care and stay safe.